I want to talk today to you about the why of wearing a protective mask and the how to wear a protective mask. This is really, really critical information for us all to protect not only ourselves, but to protect our communities. Let's start with some real basics. The coronavirus is highly infectious, and you'll see a shot here of the total cases in the world, and this is kind of about 3 weeks into April. And you can see, in January, there was practically nothing in the world, and now we're talking about, almost 2.5 million people infected, and you can see on the right-hand side the death rate just going up at the same rate as the infection rate. So it's very contagious, and because in the United States we haven't done nearly enough testing, what we are seeing is really significantly underreported. There's a lot more infection in our country than we are reporting and aware of, because the only way you can really get accurate numbers is if you tested a random sample of everybody in the country, which is 330 million people. So there's a lot more out there, which means there's a lot more opportunities to be infected. The other thing that's factual that it's really important to know, that a lot of people don't seem to really comprehend, is that many or most of the people who get the virus, who are infected, will have mild symptoms or no symptoms, but when they're infected, they are contagious. Okay, so the other day, Naya went into a grocery store wearing a mask, and somebody said, "If you're sick, don't come in here." No, it's the other way around, which is, if I'm sick, I'm protecting you, and you may be infected, and you're not wearing a mask, and so I'm not protected. So it's really important to understand that many of the people who look well and feel well are infected and contagious. So the safest attitude, is to act as if not only that you are infected and contagious, but that everybody you meet is infected and contagious. If you adopt that attitude, which is a little hair-raising, I admit, yet it really puts you in the place to take all these prophylactic measures very seriously. And that means hand washing, social distancing, avoiding gatherings, taking only critical trips. It all starts making a lot of sense if you act as if you're infected and everybody else is infected. Our knowledge of this virus keeps changing. So what I'm saying today, I think most of what I'm saying today will be accurate a month or 2 months from now. But there may be additional information that comes out. We'll try and keep you up to date. Because when the virus hit the United States in February, the recommendations from the Center for Disease Control was for the general public not to wear masks. You didn't need to wear masks. Primarily that was because they wanted to make sure that the masks that were available went to first responders, doctors and nurses and EMTs and police and firefighters and other people who are in direct contact, ambulance drivers and workers, people who have direct contact with people who are sick and are showing symptoms. And the other thing is there was not a realization of how contagious this was and how airborne droplets coming from your just normal breathing or speaking or coughing or sneezing could infect other people even when you're not that close to them. So now CDC is saying, yes, when you're in public, when you're around other people, wear a mask. So some of you may have heard this term, congregate settings. A congregate setting is where people are living in close proximity to each other. They're not single family households or apartment buildings or things like that. A congregate setting can be a nursing home, can be a prison, or any situation. Could be a monastery. I mean, where people are living in close quarters, and we are. That's the reality. Amity is primarily, most of our services are in a congregate setting where people are living in very close proximity. We do everything in community. We eat together. People sleep more than one person to a room. We do recreation together. We do circles together and seminars and ceremonies. So that makes it even more important that we are extremely careful and that we really follow these safeguarding measures to keep the virus out of our communities. So what are those things? We've talked about this before, but this is a situation where repetition is a good idea. Physical distancing, and for us, social distancing we don't really want, okay? We want physical distancing, but we want social connection, because social connection is vital for us. That's why we live in community. So we want to be safe in terms of the social distancing and wearing a mask, washing our hands, but we want to emphasize that we continue to practice community activities. We just do it safely. So that means hand washing, fresh laundry, wearing masks, disinfecting surfaces, reducing all but critical trips off campus, reducing all but critical visitors to our campus, and then making sure that all of our faculty are following these practices when they leave the campus and go home. Because if they're not careful, they could actually introduce the virus into our communities. So now we go into the mask portion. Okay, what are the types of masks? Well, there's the N95 mask. This is the mask that is the most protective. It is a mask that not only keeps the microdroplets that come out of your mouth while you're breathing or speaking from getting out into the air, but it also protects virus from coming in to your respiratory system. So these are used by medical professionals who are in highly contagious situations. A doctor who is working in an emergency room on somebody who is infected definitely needs to have this mask on. Nurses and other medical professionals. They are in very, very short supply in our country. We don't have enough of them. Our medical professionals and first responders are really upset because a lot of them are being put into situations that are very, very risky for them. If they don't have the full set of PPEs, personal protective equipment, they're really at risk. And we've seen a lot of doctors and nurses who got infected and many who have died in our country and in other countries because they don't have this protective equipment. So we want to make sure that these masks, these N95 masks, that they are at hospitals for first responders and the people who need them the most. And that we don't just have normal, everyday people snapping up those masks because we don't have the supply of them yet. We may. So they're designed to be used once, but because of this shortage, normally a doctor would go into a patient's room with this mask on, or a nurse, come out of that and dispose of the mask. But because they're in such short supply, many of these healthcare professionals and first responders are wearing them for an entire 8-hour shift. before they dispose of them. At Amity, we have some of these. We have a few of these, but we're really holding on to those for only situations where we have somebody who is showing symptoms and is quarantined, not yet sick enough to go to a hospital, and we need to bring them food, we need to check their temperature, we need to take care of them. And whoever's doing that needs to have that kind of a mask on. Just a footnote, they're now found out that both ultraviolet light and vaporized hydrogen peroxide can decontaminate one of these masks, so they can be used 2 or 3 times. But though we don't have that equipment. That of course is at the hospitals. And even after 2 or 3 times, they need to be tossed because the fit is so important. You know, because you're not just keeping your breath in the mask and filtering it. You are also trying to keep particles from getting inside and getting into your respiratory system. So next time masks, surgical masks. Anybody who's watched a TV show, doctors and nurses have seen this mask, and you see a picture of it here. It reduces, but does not prevent the virus from entering your respiratory system. Okay? Only the N95 mask prevents the virus from getting in. But it cuts down the possibility of virus being transmitted to you. It does help you, if you have one of these masks, and we have a lot of them at Amity right now, it'll prevent you from infecting others. And it's essential in preventing the spread of the virus. Designed to be used only once, that's the design, but we have discovered you take this mask and put it in a paper bag for 24 hours, a sealed, clean paper bag, and in 24 to 36 hours you can wear it again. Okay? And so that's good because that keeps us from using thousands of these things and keeps the supply adequate for medical professionals who still need to use these. Here we have the cloth mask, which is primarily what we're going to be using at Amity. Keep in mind, it does not prevent the virus from entering your respiratory system. That's why everybody needs to be wearing one of these things, okay? It keeps you from expelling these micro droplets, the larger droplets and then the micro droplets that could infect other people if you were infected. And remember, you're acting as if you are infected. You want everybody acting as if they are. And that's the reason why you wear the mask and why you want everybody else wearing the mask when you're in a congregate setting. It is essential to slow this virus down that we use these masks. You may think they look funny, they may feel uncomfortable, but you know, we don't want people sick, we don't want people in hospitals, we certainly don't want people dying because they've been infected for some reason, just because they didn't like the look of it or it wasn't comfortable for them. It can be reused as long as it fits. You know, you just have to wash it in hot soapy water in a washing machine, or you can do it in a sink, but give it a really good scrub and then hot dryer or out in bright sunshine until it's air dried thoroughly. You don't want to put on a mask that isn't thoroughly dry. Okay, you wear glasses and you discover that your eyeglasses are fogging up all the time. So what do you do about that? Well, first thing you do is take your mask and tighten the ear straps, you know, and get a tighter fit. Because what's happening is the air is going out of the top of your mask, and that's what's fogging your glasses. Okay, so that doesn't work. What's the next thing you do? Well, you can use your glasses, pull the mask up and make sure it still covers your chin. Use the weight of the glasses to seal the mask on your nose. And that will prevent the air from going up. Suppose that doesn't work. And apparently all medical students who wear glasses learn this pretty early on because they're wearing them all the time. Take a piece of medical tape. Don't use duct tape or you'll pull your skin off. But use a piece of medical tape, one of those tapes that is designed to be on skin and to be removed, and seal the top of your mask. And one of these three methods will work. And if you really are desperate, you can get an anti-fog and put it on the lenses of the glasses, and that'll do the trick as well. Okay, here's some don'ts about wearing a mask, and you can look at the pictures here as I go through this. Don't wear the mask below your nose. That doesn't work. We got to cover both of the openings where breath is coming out. And don't leave your chin exposed, okay? Don't wear your mask loosely with gaps on the side, okay? Because the droplets you're expelling are quite light and travel, and they can go right out the side of your mask, which defeats the entire purpose. Don't wear your mask so it just covers the tip of your nose. Cover your nose thoroughly and keep your chin covered. And I've seen this a lot, and in fact, I made this mistake myself. Because I'm driving in my car, I don't really need the mask in my car, so I pull the mask down so my face isn't covered. Bad idea. Once you put the mask on, leave it on. Leave it on, covering your face. If you're going to remove it, then you want to wash your hands thoroughly, and then only using the ear straps, take it off, and then it's time for washing it and disinfecting it. So do wear your mask so it comes all the way up, close to the bridge of your nose and all the way down under your chin. Tighten the loops and make sure that it's snug around your face without big gaps. So here's the doing it right. Always wash your hands before and after wearing a mask. And just like your face, don't touch it while you're wearing it. Because if your hands have been on a contaminated surface, you're then contaminating your mask. Use the ties or loops only to put on your mask and remove it. Don't grab it in the front. Make sure it fits properly. Wash and dry your cloth mask daily and keep it in a clean, dry place. Okay? Don't just throw it on, a shelf or tape. Put it in a special place where you know that it's safe and will remain clean and dry. Your surgical mask, put it in a label with your name on it, closed paper bag for 24 to 36 hours after use. So you should probably have 2 or 3 of these surgical masks if you're going to be wearing surgical masks, so you can rotate them. And probably a couple of the cloth masks for the same reason. Don't take risks just because you're wearing a mask, okay? Still practice the social distancing. Remember that you can be infected while wearing a mask. It's not protecting you from these airborne droplets, okay? It is protecting other people from your airborne droplets. So, don't act like, well, I got a mask on, I'm cool. Practice all the other things. Wear gloves when appropriate, hand wash always, practice social distancing. All those things together, plus the mask, is the thing that's going to really stop this virus. Now you're going to see now 2 videos that are going to really help you understand the why of wearing a mask. One is from Japan, which really shows dramatically these microdroplets and how they can actually fill a room. And once you see this, I am convinced you will be much more enthusiastic about wearing a mask, because you really, we can't see what comes out of our mouth. We can hear it, and occasionally, so when somebody's yelling or something like that, we'll get something, oh, okay, the person, you know, some of their spittle or something ended up on my shirt. Well, that's pretty dramatic. But what we find out is that even breathing, without coughing or sneezing, these droplets can go 10 or 20 feet and stay in a room for not just minutes, you know, but maybe a half an hour or an hour or something like that, particularly in rooms, and we have a lot of rooms at Amity that don't have very good air circulation. So watch this carefully, and then you will find that wearing a mask seems like a much better idea than you perhaps think right now. The other one I love is from the Czech Republic. The Czech Republic has been pretty good at flattening the curve of infection in their country. And one of the things they did immediately, which we didn't do in the US, is immediately recommend that everybody wear a mask. And there's a lovely young lady who explains this and really talks about their mantra is, I protect you, you protect me, when we're both wearing a mask. And I think that's a very, very good message. So I hope this is useful. You may have questions. Obviously, this is a video. I can't answer your questions beyond what I've said, but certainly ask the folks who are presenting this to you if you have further questions. And look, there's lots and lots of information online that you can look up to learn more about this. But I spent a little bit of time on this, and I think this is a fairly comprehensive picture of how and why to wear a mask.
So how does this take place? NHK is conducting an experiment with a group of researchers. The team will track particles in the air using laser beams and a high-sensitivity camera. This technology allows us to detect droplets as small as 0.1 micrometers wide. The experiment starts. First, sneezing. We can see a large droplet about 1 millimeter in diameter. It quickly falls. But let's look through the high-sensitivity camera. We can see small particles that seem to glitter floating through the air. These particles are all smaller than 10 micrometers, or 1/100th of a millimeter in diameter. Let's take a look from a different angle. They're small and light. You can see them drifting through the air. These are microdroplets. We're learning that sneezing isn't the only source of these droplets. We ran the same experiment on a close-range conversation. People generate a lot of microdroplets when they talk loudly. The droplets between these two stay where they are. They don't drift away. It's not yet known what volume of microdroplets leads to infection. But Tateda says we can't rule out the possibility that microdroplets have spread the virus to some extent.
そのマイクロ飛沫、小さな粒子の中にもたくさんのですね、生きたウイルスがいて、大きな声での会話、あるいは激しい息遣い、そういった中でですね、このマイクロ飛沫ができて、それが近くの人、その人が吸い込むことによって感染が広がる、そういったリスクが見えてきたものと思います。
The risk of infection through microdroplets becomes even greater in a closed space with poor ventilation. This lab is simulating the movement of microdroplets in an airtight room. About 10 people in an enclosed space the size of a classroom. A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the microdroplets, shown in red, continue to drift. This simulation uses only microdroplets. 5 minutes later, 10 minutes later, 20 minutes later, the microdroplets are still floating in place.
空気がよどんでいると、つまり空気の流れがないということで、マイクロ飛沫そのものは、落ちたり、違う場所に動くことができませんので、長時間その場所にとどまるっていうことになります。
But there is a way to prevent this stagnation of microdroplets. Opening windows and increasing air circulation is believed to be effective. When you open a window, microdroplets are quickly swept away. They're very small and light, so any airflow will get rid of them.
"できればですね、2箇所開けて風の流れを作ってあげるということが大事。それが1時間に1回でもいいから、そういうようなことをやることによって感染のリスクっていうのはかなり下げることができるようになるんじゃないかなというふうに思います。
We have an important message for all of you, especially if you live in a country that is right now facing the new coronavirus. The pandemic is growing exponentially in many countries. But the Czech Republic is one of the few in Europe that has significantly slowed down the spread of the virus. In this video, we would like to tell you what we did differently, and mainly, we would like to help you to do the same. We are following social distancing and the rule stay at home. But others do that too. We also have strict hygienic procedures. Others do that as well. But the main difference is everyone who has to leave their house has to wear a face mask. Everyone.
I know, they may be told you that masks wouldn't protect you, but there are studies proving that even a homemade mask can be partially protective. Partially. Any protection is essential today. But now the more important thing. Masks fundamentally prevent the transmission from you to others by sneezing, coughing, but also breathing. And many people are the most contagious before they start showing symptoms. So, when we both have a face mask, I protect you, you protect me, and we are both safe.
Based on recent data, we know that population-wide use of masks is essential for suppression of the outbreak.
According to our professional experience, a simple homemade mask can prevent up to 100% of the spread of potentially infected microdroplets.
The more people use masks, the less virus can be distributed and fewer individuals are exposed.
Just a few days ago, people were laughing at those who wore masks. But some people knew about this positive effect and started to share this information across social media. The message grew fast through artists, influencers, and others. I know, face masks aren't in stores, right? But something incredible happened. People started making homemade masks and giving them to others for free. Many companies, theaters, or even retirement houses changed their buildings into sewing rooms, and thousands of people started to sew masks at home. So we know that face masks work, and it has been repeatedly confirmed by scientists. We know that it is possible in just 3 days to provide face masks for 10 million people in one country. And we know that here we have fundamentally repressed the infection. Please share this knowledge and help us to change as many countries as possible. Take a picture with your face mask on and share it with the hashtag #MasksForAll. It can really save lives. And remember, I protect you, you protect me.